We are days now from the opening ceremony, the Summer Olympics in London. I'm so excited.
Oh, I know. It's going to be amazing. Athletes who worked for so many years, so many hours to compete at this level. Today we're talking with Dr. Matthew Axman from Sports Medicine at Spectrum Health Medical Group about the athletes they work with and a chance for you to ask some questions.
All right, so first of all, define for us who is an athlete, because once the Olympics come on, every kid's going to be in the backyard doing soccer maneuvers, doing gymnastics flips. I mean, it's exciting. We want to be like them.
Yes, and a lot of times that's what people think of when they think of an athlete. They think of somebody who takes place in competitive sports. So what they'll do is they'll think of the professional athlete, the football player in the NFL, NBA, Major League Baseball. With the Olympics coming up, they'll also think of the Olympians, college athletics, high school athletics, so somebody who participates in mass events like that. But really an athlete is anybody who wants to maintain an active, healthy lifestyle, anybody who wants to get out and do things for exercise. So an athlete to me is anybody who can be from that professional athlete, an ultra-marathoner, Ironman competitor. It could be somebody who's joining a recreational soccer league, that weekend warrior who's playing a pickup flag football game on the weekend, somebody walking around the mall for exercise, or even a grandfather on the weekend who wants to toss a baseball around with their grandson or granddaughter. So basically anybody who wants to maintain that active, healthy lifestyle is an athlete to me.
Well, you've empowered me. I feel like I might be an athlete after all. That's exciting.
So then let's talk about what you do, sports medicine. What exactly does that cover in the realm of treating athletes?
Sure. So sports medicine, at the core of sports medicine is a group of physicians, both non-surgical, which is what I do, as well as surgeons who are trained in treating musculoskeletal injuries. And that includes anything from bone to muscle to ligaments to tendons to joints, and getting the athlete back. But what we also do is we also have training in regards to the athletes also, and taking a look at what they're doing, taking a look at their biomechanics, the structure of the athlete, the function of the athlete in their specific sport, and being able to treat them to get back to that active lifestyle. And what Spectrum has really done is really modeled a group of physicians, because sports medicine just doesn't end with the sports medicine physician. You've got athletes who have diabetes, athletes who have high blood pressure, cardiac problems, asthma, lung problems. And so we've modeled the sports medicine group at Spectrum against some of the top-rated sports medicine programs in the country, so that we have the ability to consult cardiologists, pulmonologists, endocrinologists, neuropsychologists, just a whole realm of physicians, as well as physical therapists, athletic trainers, nurses, everybody to take care of these athletes.
Wow, you've got a full service right
Yes.
there. Now, I know high school sports are starting up in just a couple of weeks. Actually, next week, we'll be doing the two-a-days, and kids will be busy, busy, busy. What do we as parents need to be on the lookout for as our athletes jump back into the sport? And it's pretty competitive at a lot of high schools.
Exactly. Very competitive in sports nowadays, much different than from when I was growing up in regards to
You just showed up with a pair of tennis shoes and you were on the team.
Exactly. So really the biggest thing is prevention. That's kind of one of the big keys of sports medicine is prevention. So education, educating the athletes on strength, stretching, exercise, proper techniques, the equipment that they need to be able to get into their sport, to prevent those injuries so that they don't have to be sidelined and take time off from that sport. So things that we can do in sports medicine is take a look at that athlete and individualize treatment, because there are so many things. You have soccer, you have lacrosse, you have CrossFit, Zumba, all of these different things that people are doing. Each athlete is going to be treated different. If somebody comes in with knee pain, somebody who is a cyclist is going to be treated than somebody that's a runner. So we're going to be able to individualize that treatment of that patient. Other things that we can do are take a look at what the patient's doing structurally, equipment-wise, whether they need bracing for that certain injury that they have, and also talk about getting them back to their activity, but maintaining a healthy lifestyle in the meantime. So if they are sidelined with a leg injury, a knee injury, a foot ankle injury, teach them how to do upper body things so that they can maintain that active lifestyle too. Other things that we've also done at at Spectrum are really bringing technology to the forefront. We've had the ability to do ultrasound medicine at Spectrum, both diagnostic and therapeutic, and basically that's technology that they use to take a look at babies, but what we do is we're able to look at muscles, ligaments, tendons, and evaluate the injuries and treat those properly without needing really expensive tests and other invasive procedures.
Yeah, this is good to know, because as the Olympics starts, we're going to be thinking about you and what you do and the army of people that just have to be there to make it all happen. So thank you so much. If you're interested, we have that contact information on your screen right there.
And you have a special event.
Yeah.
We do. We have a free doctor dialogue that's coming up towards the end of August. It's going to be strong knee, strong game, and we're going to be talking about ACL injuries, meniscus injuries, arthritis, as well as patellar diagnoses, tendonitis, and patellofemoral pain syndrome. So that's free to the public to come out and listen to us talk about that.
Yeah, so you
That's
can
pretty
attend
young and
or
old.
even stay at home and connect through your computer.
Yes.
That's really nice. Well, thank you so much for coming in.
Thank you.
We'll be right back.